5 silent signs your dog may die while sleeping tonight. Most dogs who pass away in their sleep showed signs beforehand. Real, medically recognized signs their owners saw but didn't know what they meant. I didn't know either until the night I almost lost Milo. Stay with me. This may be the most important video you watch for your dog today. I'm Sarah, and before we get into this, I want to be completely honest with you. I am not a veterinarian. I'm a dog parent who became obsessed with truly understanding canine health. Everything I'm sharing today comes from research. I'll cite every source. Sign number 1, labored or irregular breathing during sleep. Normal sleeping dog breathing is soft, rhythmic, effortless. Gentle chest rises, maybe a light snore. That is completely healthy. Here is what is not normal. Breathing that looks like work, the stomach heaving with every breath instead of just the chest. Long pauses followed by sudden rapid shallow ones, a crackling or wet sound from the chest, or breaths consistently faster than 30 per minute while resting. A 2017 study published in the Journal of Veterinary Internal Medicine found that owners who monitored their dog's resting respiratory rate at home were able to detect early heart failure weeks before clinical symptoms appeared. Weeks! The study recommended counting breaths per minute while your dog sleeps as an early warning system. Anything consistently above 30 warrants a call to your vet. What I heard with Milo that night was a subtle catch. Every few breaths, something hitched, just slightly, but different from his normal. And different always deserves attention. If your dog's breathing while sleeping ever looks like effort, count the breaths, time 1 full minute, and if you're unsure, call your emergency vet. That call is always worth making. Sign number 2, and this is something I want you to physically check after this video: gum color. Gently lift your dog's upper lip and look at the gums above the teeth. Healthy dog gums should be pink, bright, moist bubblegum pink. When you press them gently with one finger, the color should return within 1 to 2 seconds. That is called capillary refill time, and veterinary medicine uses it as one of the primary indicators of cardiovascular health. According to the Merck Veterinary Manual, the globally recognized reference used by veterinary professionals worldwide, pale, white, gray, or bluish gums indicate critically reduced blood flow or oxygenation. Blue gums specifically, a condition called cyanosis, mean blood oxygen has dropped to a dangerous level. These are signs of shock, severe anemia, congestive heart failure, or internal bleeding. If you check your dog's gums and the color is wrong, you do not wait until morning. You go to an emergency vet now. Make a habit of checking once a week. Lift the lip, look, press gently. That simple check could save your dog's life. Sign number 3, and I want to be precise here because it has 2 completely different meanings. Twitching during sleep. Light twitching, paws paddling, soft lip quiver, little whimpers is almost always completely normal. That is REM sleep. That is your dog dreaming, and honestly, it is one of the most beautiful things you will ever watch. A study published in the Journal of Sleep Research confirmed that dogs experience REM sleep cycles remarkably similar to humans, including muscle twitches, eye movements, and vocalizations. Those little dream runs are real. Your dog is genuinely dreaming. But a seizure looks completely different. Rigid, uncontrolled, full-body muscle contractions. Your dog cannot be woken up. Jaw chomping, heavy drooling, limbs stiff or paddling violently, eyes open but unseeing, lasting more than 30 seconds. According to the American College of Veterinary Internal Medicine, seizures lasting more than 5 minutes or multiple seizures within 24 hours are classified as a veterinary emergency requiring immediate treatment. Light dream twitches with easy waking, let them dream. Full body rigidity, unresponsiveness, heavy drooling lasting more than 30 seconds, call your vet immediately. Knowing the difference is not complicated, but it is critical. And hey, if this is giving you real information you didn't have before, hit subscribe. Every week, I share research-backed content that actually makes you a better dog parent. Okay, sign number 4. Sign number 4, your dog crying or yelping in sleep. Soft, dreamy whimpers, normal. beautiful, let them dream. But a sharp, sudden yelp like something hurt them, repeated crying that sounds distressed, whimpering that continues as they slowly wake up, yelping when they shift positions even slightly, that is different. A landmark pain assessment study published by Colorado State University's College of Veterinary Medicine established that involuntary vocalizations during rest are one of the most reliable indicators of acute or chronic pain in dogs. The research found that dogs instinctively suppress pain signals while awake around their owners because of deeply ingrained pack survival behavior. Your dog may be in significant pain and hiding it from you every waking hour, but during sleep, when those instincts relax, the pain breaks through. Milo yelped once in his sleep, just once. I was at his side in seconds. He was okay that night, but I never forgot that sound. If your dog cries in a way that feels like pain, not dreaming, note when it happened, how long, what it sounded like. Bring that to your vet. Their body is asking you for help in the only way it knows.
Sign number 5, the most important one, complete unresponsiveness while sleeping. A healthy sleeping dog, even in deep sleep, should respond to their name, to a gentle touch, to a familiar sound, maybe slowly, but they come back to you. If you call your dog's name, touch them gently, and they do not respond, according to emergency veterinary protocols established by the Veterinary Emergency and Critical Care Society, immediately assess 3 things: airway, breathing, circulation. Is the airway clear? Is the chest rising and falling? Are the gums pink? If they are breathing and gums are pink but won't wake up, call your emergency vet immediately. Do not drive first. Call first. Describe exactly what you see. And I want to say this clearly. Unresponsiveness is not always the end. Hypoglycemia, certain toxin exposures, severe exhaustion. A dog can be unresponsive and fully recoverable if treated immediately. The difference between a dog that makes it and one that doesn't is often measured in minutes. Always check. The cost of checking unnecessarily is nothing. The cost of not checking when you should have is something you never recover from. If someone you know needs to hear this, please send this video to them right now. And if you're not subscribed, join this community. We are here for one reason: to make sure our dogs live the longest, healthiest, most understood lives possible. The night I sat in that vet parking lot, after they told me we caught it in time, I made myself a promise. I would never walk past a sign Milo was giving me just because I didn't know what it meant. Because here is what I know about dogs. They do not complain. They do not ask for help. They have spent thousands of years learning to hide their pain from the people they love. So when something goes wrong, they go quiet. They sleep more. They get smaller. And we walk past it. Not because we don't love them, because we didn't know. You now know what labored breathing sounds like, what pale gums mean, the difference between dreaming and seizing, what pain sounds like in the night, and what unresponsiveness demands of you. This is not information to fear. This is information to carry, because your dog cannot advocate for themselves. That is your job. And the fact that you're still here watching this means you're already exactly the dog parent they need. Here is what I want you to do tonight. Just 60 seconds. Check their gums, pink and moist. Watch their breathing, soft and rhythmic. Count breaths for 1 minute. Under 30, you're good. And when they settle, just watch them for a moment. The rise and fall of their chest, the little dream twitches, the way they find their spot. Memorize their normal, because when you know they're normal, you will always recognize when something is wrong. If this gave you something real today, save it and send it to every dog parent you know. Drop in the comments, are you going to check your dog's gums tonight? I read every single one. Subscribe, because every week I will give you something real, something that makes you a more informed, more connected dog parent. Go check on your pup right now. Put your hand on their side. Feel them breathe, and just be grateful for this moment, because that dog is someone's whole world, and that someone is you.